This is Dr. Foley, and today, or this week, is actually Cholesterol Awareness Week. So we're going to talk a little bit about cholesterol. Now, most people know the basic cholesterol. Your total cholesterol medically should be 150 to 200. Functionally, it could go up to 240 before we're really concerned about it. This is a functional number. Your HDL, they want that about 40 to 60, and we want it about 60 to 100. So you want your HDL, which they call your good cholesterol, high. We're going to talk about that here in just a minute. Triglycerides, that's a form of sugar. Your triglycerides, medically, they want about 150, no more than 150 or below. We would like that at 100 or below. Anything over 100 really means you're eating too many carbohydrates, and you got to get that triglycerides down to 100. And then your LDL. Now, your LDL, they actually call the bad cholesterol. In reality, there's no good, there's no bad, but this is the one that sticks to the arteries, so they call it the bad cholesterol. And right now, medically, they want that at 100 or below. Now, I don't get too concerned unless it's over 130. These numbers, these functional numbers, have been there for years and years, back in the 60s, 70s, and 80s, and then they keep going down lower and lower. But let's say that you came in and your bad cholesterol, your LDL, was 160, and of course, your doctor's going to say something about that. Well, normally what they do is they give you a statin drug and try and drive that down. But that's not what we do in my office. In my office, we want to get the HDL up. For every point you get the HDL up, your LDL goes down 2 to 4 points. So how do you get the HDL up? Well, omega-3 fatty acids is how you do that. And we have several of them that we would use and find out which person and which one would work best for that person. Prima from Standard Process, EPA, DHA, those are the different types of omega-3s that you need. Also, omega-3s will bring down your triglycerides. So we bring up the HDL, that'll bring down your LDL, and it'll bring down your triglycerides. Another one is Prima EPA. Now, some people might test for the Prima EPA DHA, some for the Prima EPA, and then we got Prima DHA. So it depends on the person and which fish oil. Not all fish oils are the same. Let's say that you buy some fish oil on the open market. Now, if you buy it from me, these are professional grades, so we don't have to worry about the quality of those. But if you buy them on the open market, what you need to do is they'll come in pearls. You need to cut the pearls. You need to do a test. You cut the pearls and you smell it. If it smells like garbage, that's rancid fish oil. You'll never know because they're in pearls. Then you take that pearl, you squeeze it into a styrofoam cup, you put the cup in the sink, and you wait about 45 minutes to an hour. Look in the cup and see if it ate the bottom of the cup out. If it ate the bottom of the cup out, they're using solvents to extract the fish oil. Go back and get your money back or throw those away. If they eat the bottom of a styrofoam cup out, what do you think they're doing to your stomach? So we use high quality omega-3s, we don't use a lot of omega-6s, but we do have those. Omega-3 mainly is what we want. We get a lot of omega-6 in our diet, but the omega-3s get processed out. So here's the overall thing of what we want to do. We want to increase the HDL. We want to get that 60 to 100 if your HDL is low. And we want to bring down the LDL. For every point the HDL goes up, the LDL goes down 2 to 4 points. And your cholesterol or your triglycerides will also go down. So, if you want more information on that, we are having the Cholesterol Awareness Week. You're welcome to come to the workshop. It's going to be this Saturday at 10 o'clock. We'll talk about the liver, and we'll talk about other things that cholesterol does. And by the way, cholesterol does not cause heart disease. It's a secondary problem, not the primary problem. And if you want to know what the primary problem is, you're going to have to come to the workshop. It's this Saturday, starts at 10 o'clock, totally free. Just call 615-333-0021. That's 615-333-0021 and ask to schedule for the workshop.